Are you feeling off lately? It might not just be a case of the Monday blues. Well, today we're diving deep into a crucial aspect of your health: blood sugar levels. Stick around because we're going to uncover 12 telltale signs that your blood sugar might be soaring higher than a bird in flight. Let's discuss first what causes high blood sugar to spike. High blood sugar, also known as hyperglycemia, refers to an elevated level of glucose, sugar, in the bloodstream. This condition occurs when the body either doesn't generate sufficient insulin, a hormone responsible for blood sugar regulation, or is unable to use insulin effectively. As a result, glucose accumulates, a form of sugar, acts as the main energy source. That's why spotting the key signs of high blood sugar early is crucial. But before we dive into those signs, let's break down glucose. Glucose, it's a substance we get from the food we eat, a form of sugar. Which one of the main energy source in the body? It's a simple carbohydrate that our bodies break down from the carbohydrates we consume in foods like bread, rice, pasta, fruits, and vegetables. Once we eat these foods, our digestive system breaks them down into glucose, which then enters our bloodstream. Glucose travels through our bloodstream to reach our cells, where it provides energy for various bodily functions. Our cells use glucose as fuel for activities like walking, running, thinking, and even sleeping. In essence, glucose is like the fuel that powers our bodies, allowing us to carry out all our daily activities. However, for glucose to enter our cells and be used for energy, it needs insulin, a hormone produced by the pancreas. Insulin acts as a key that unlocks our cells and permits glucose entry for energy utilization. Without enough insulin, or if our cells become resistant to insulin, glucose can't enter our cells efficiently, leading to high levels of glucose in the blood, a state referred to as high blood sugar or hyperglycemia. Untreated hyperglycemia over extended durations can result in harm to nerves, blood vessels, tissues, and organs. Intense hyperglycemia can additionally precipitate a sudden and severe life-threatening condition known as diabetic ketoacidosis, DKA, particularly in individuals with diabetes who are on insulin therapy or those with undiagnosed type 1 diabetes. Swift medical intervention is imperative in such cases. Now let's break down the level of hyperglycemia. Before we continue, remember to subscribe for more health tips. For people who haven't been diagnosed with diabetes, hyperglycemia means having blood sugar levels higher than 125 mg/dl, milligrams per deciliter, after not eating for at least 8 hours. If someone's blood sugar level is between 100 mg/dl and 125 mg/dl when they haven't eaten for a while, they have prediabetes. If someone's blood sugar level is consistently higher than 125 mg/dl after not eating for a while, they often get diagnosed with diabetes, usually type 2. People with type 1 diabetes often have extremely elevated blood sugar concentrations, exceeding 250 mg/dl when diagnosed. For someone with diabetes, having high blood sugar, hyperglycemia, typically means their blood glucose level is over 180 mg/dl 1 to 2 hours after eating. However, what's considered high can change depending on your specific blood sugar goals. Even people without diabetes can experience blood sugar spikes when glucose builds up in their bloodstream. What are the signs of hyperglycemia? Sign number 1, frequent urination. Frequent urination, known as polyuria, is a common indication of elevated blood sugar levels. In hyperglycemia, the kidneys work overtime to eliminate excess sugar from the bloodstream, leading to increased urine production. This could lead to frequent bathroom visits, particularly during the night. Disrupting sleep patterns. Sign number 2, excessive thirst. Excessive thirst, known as polydipsia, often accompanies frequent urination in individuals with high blood sugar levels or hyperglycemia. This occurs because the body loses fluids through frequent urination, leading to dehydration and triggering feelings of intense thirst as the body seeks to replenish lost fluids. Keeping track of blood sugar levels and seeking advice from a healthcare provider is important, essential to managing hyperglycemia and alleviating symptoms like excessive thirst. Sign number 3, blurry vision. Elevated blood sugar levels, also known as hyperglycemia, may result in blurry vision due to its impact on fluid levels in the eyes. This can cause the eye's lens to swell, resulting in difficulty focusing and blurred or distorted vision. Regularly checking blood sugar levels and seeking medical guidance for sudden changes in vision are crucial to preventing complications and preserving eye health. Sign number 4, headache. Elevated blood sugar levels can potentially lead to headaches or migraines due to several interconnected factors. In instances of high blood sugar levels, it may impact the function of blood vessels throughout the body, including those in the brain. Additionally, hyperglycemia is associated with increased inflammation in the body, including within the blood vessels. Inflammation can further contribute to changes in blood vessel function and may exacerbate headache symptoms. It's important to note that the relationship between hyperglycemia and headaches is complex and may vary from person to person. Not everyone with high blood sugar levels will experience headaches, and other factors such as hydration status, stress levels, and individual susceptibility to headaches can also play a role. Sign number 5, fatigue. Fatigue, often linked to high blood sugar levels, stems from disrupted glucose utilization, the body's main energy source. In hyperglycemia, cells struggle to absorb glucose due to insulin resistance or low insulin levels. This deprives cells of energy, leading to tiredness. Additionally, hyperglycemia may disturb electrolyte balance, causing dehydration and compounding fatigue. Moreover, fluctuations in hormone levels like cortisol and adrenaline can worsen fatigue. It's important to note other factors, such as poor sleep, stress, or medical conditions, can also cause fatigue. Lifestyle adjustments are crucial to managing fatigue and hyperglycemia. This includes a balanced diet, regular exercise, proper hydration, and medication adherence. Monitoring blood sugar levels regularly and consulting healthcare professionals for persistent fatigue is essential for overall well-being. Sign number 6, unexplained weight loss. If you're shedding pounds without trying, it could be a red flag for high blood sugar levels. When your body can't use glucose for energy, it turns to muscle and fat stores for fuel, resulting in unintended weight loss. Sign number 7, yeast infection. Elevated blood sugar levels compromise the immune system, leaving individuals more vulnerable to infections like urinary tract infections, yeast infections, and skin infections. Elevated glucose levels create an environment conducive to bacterial and fungal growth, making it easier for infections to take hold. The weakened immune response also hampers the body's ability to fight off these infections effectively. Consequently, individuals with high blood sugar levels may experience recurrent or persistent infections. Effective control of blood sugar levels achieved through lifestyle adjustments and medication adherence is essential for strengthening the immune system and minimizing the likelihood of infections in individuals with diabetes. Regular monitoring and prompt treatment of infections are also essential for preserving overall health and wellness. Sign number 8, slow healing wounds. Elevated blood sugar levels can delay wound healing by impairing the body's ability to repair damaged tissue. This sluggish healing process can be observed in cuts, bruises, or other injuries, which may take longer to heal than usual. High glucose levels interfere with the body's natural healing mechanisms, affecting cell proliferation and tissue regeneration. Managing blood sugar levels appropriately is vital to facilitate timely wound healing and prevent complications. People with diabetes should diligently monitor their blood sugar levels and seek medical attention for slow-healing wounds to avoid further complications. If you or your child have these symptoms, visiting your doctor is important. For people with diabetes, symptoms may not appear until their blood sugar reaches 250 mg/dl or above. But for those not diagnosed yet, symptoms may occur at lower levels. Sign number 9, increased hunger. High blood sugar levels can trigger increased hunger even after eating regular meals. When cells cannot efficiently use glucose due to insulin resistance or insufficient in glucose, the body perceives a lack of energy and signals for more food. This persistent hunger occurs because cells are deprived of the necessary energy, leading to a continuous feeling of hunger. Effective control of blood sugar levels by making lifestyle changes and medication adherence is essential to address increased hunger and prevent complications associated with hyperglycemia. Sign number 10, numbness or tingling in hands and feet. Elevated blood sugar levels can harm nerves in the extremities, causing sensations like numbness, tingling, or pain in the hands and feet. This condition, known as diabetic neuropathy, arises due to nerve damage resulting from prolonged exposure to high glucose levels. Numbness and tingling sensations may indicate nerve dysfunction, impacting mobility and sensory perception. Appropriate control of blood sugar levels, in addition to lifestyle adjustments and medication adherence, is crucial to avoid additional nerve damage and ease symptoms of diabetic neuropathy. Regular monitoring and timely medical intervention are essential for maintaining nerve health and overall well-being in individuals with diabetes. Sign number 11, dark skin patches, acanthosis nigricans, characterized by dark, velvety skin patches in body creases like the neck, armpits, and groin, is linked to insulin resistance and heightened diabetes risk. These patches, often appearing gradually, signal underlying metabolic changes. Insulin resistance prompts excessive insulin production, stimulating skin cell growth and melanin production, leading to skin discoloration. Recognizing these patches is crucial as they can serve as early warning signs of insulin resistance and impending diabetes. Lifestyle modifications and medical intervention, including blood sugar monitoring, are vital for managing insulin resistance and reducing diabetes risk in individuals with acanthosis nigricans. Regular skin examinations and prompt medical attention are recommended for early detection and intervention. Sign number 12. Mood swings and irritability. Blood sugar fluctuations can significantly impact mood, causing irritability, anxiety, or depression. These mood swings result from the body's struggle to regulate glucose levels, affecting neurotransmitter function and hormonal balance. When blood sugar levels fluctuate, it disrupts brain chemistry, triggering emotional instability. Checking blood sugar levels during mood swings is advisable, as it can provide insights into potential underlying causes. Effective control of blood sugar levels through lifestyle changes and medication adherence is essential for stabilizing mood and improving overall emotional well-being. Seeking support from healthcare professionals or mental health professionals may also be beneficial in managing mood swings associated with blood sugar fluctuations. Before we wrap up, don't forget to hit that subscribe button below and hit the notification button so you never miss out on our latest health tips and insights. Managing high blood sugar levels involves modifying lifestyle habits like adopting a nutritious diet and participating in consistent regular physical activity, consistently monitoring blood sugar levels, adhering to prescribed medications, and promptly seeking medical advice if symptoms persist or deteriorate are all crucial. Always prioritize your health, as it is your most valuable asset. Take care of it. Thank you for watching, and see you in the next video.